Any questions for Dr. King or Dr. Mersky?
Steve. Yeah.
Great.
I think I'm still on. Steve, you got good lungs. Just talk. Okay.
All right, easily. I think they need to pick it up. Pick it up over there, I guess. This being, of course, I'm here because there's this TMJ interconnectedness here with manual medicine. And as I'm listening to you and I'm hearing about the infants, the high degree of distortion in cranial patterns that can be relieved by manipulation, I think about this environment in place when the first teeth develop, right? We have a distorted pattern, and now the teeth are coming in, the positioning of the TMJ. Could you comment on that?
The clinical experience is that indeed you do improve the occlusal surface. I work with a dentist. He has dentosomatics. And basically, the sphenobasilar symphysis and intermaxillary suture can be expanded, probably compressed because of the birth trauma or other blows to the head. So yes, my experience is that I head off a lot of orthodontia, sorry Steve, by doing the cranial manipulation. Yeah, comment on that? Okay.
You're good. Thank you.
Yeah. So, and this is all available online. If any of you are interested in the citations, they're all there to be had.
Yeah, they're all downloadable off the website. Any other questions?
Yes.
A while back, and this is probably, maybe 6-7 years ago, we had a presentation by Dr. Nordstrom at my study.
Oh, Derek.
About this, movement of the cranial bones relative to some of these degenerative diseases. Okay, I don't know if you got wind of that, and I was just asking what, if anything, I haven't heard anything since, but is Richard still there? Richard?
Yes.
Were you there when Derek gave the talk about the...
Yes.
Yeah, so you remember. But started with some Canadian, I think. That
It was excess motion in the temporal.
Yeah.
And the temporal squamosal and
One of the
instability.
things that came out of that, because Derek got one of these prototype machines, and my son had started developing MS-like symptoms. We went to Hollister and checked him out. And while we were doing that, Derek had a lot of problems with the machine, but the result was I was holding the sensors on my son's head, and I generally don't feel much, And I mean, there was no doubt, but there was some significant movement in his cranial bones when we were doing this. So we never got a really good reading from the machine, but I got plenty of reading in my hands. But I was just really curious because you're talking about, how NASA got involved, and that right away, popped up a flag with me.
It's just so automatic, intuitively obvious that if you affect the teeth, which are cranial bones, you're going to affect the whole cranial and neuromusculoskeletal system. The whole thing affects. I had one dentist, he puts a little splints between to improve the occlusal surface, had him kind of bite down, and a person could walk straighter. So it affects the temporal bone, the semicircular canals, your balance equilibrium. You improve the alignment, just improve everything about the person's balance and equilibrium and gait biomechanics.